Brenda Nazareth Menezes is a consultant dermatologist by profession, having obtained the diploma in skin diseases in 1981 and her MD in dermatology in 1986. Dr. Brenda, I understand that World Skin Health Day is being observed around the world. What exactly is it all about?
Well, yes, World Skin Health Day has been started all over the world by the International League of Dermatological Societies to create an awareness among the general public about the importance of having good skin hygiene and health. For this contributes to the overall well-being of the person himself or herself. It is like having a healthy mind and a healthy body. So a healthy skin contributes greatly to having good all-round health and vice versa. Now this day can be held throughout the year, and it is being held in different countries on different days. In India, the Indian Association of Dermatologists, Venereologists and Leprologists are going to observe this day on the 6th of April, but the highlighting points will be focused upon throughout the year. This association is the second largest body of dermatologists all over the world. And in India, it is the largest official association of dermatologists. And so this is what the World Skin Health Day is all about.
Is there any specific theme or activity that has been planned around this?
Yes, very much so. The association, the IADVL, has put forth 3 points to be highlighted during this day and throughout the year. The first is on having good skin hygiene and good skin health, and the awareness of certain diseases, especially leprosy and vitiligo. The second point is about the misuse and the abuse of topical corticosteroid creams. And the third is on the prevention of quackery in dermatology. There is also a fourth point that they have put up for consideration, that of having expensive biologics made available to the patient through insurance.
Can you tell us more about how one can maintain good skin hygiene?
Yes, especially in these hot summer months, it's essential that the person bathes regularly, frequently, removes all the excessive sweating on the body, and even to the extent of using a washcloth or a loofah or a sponge to remove the dead cells that accumulate on the body. Then it is important to use sometimes an antibacterial soap, though even that is sometimes, questioned whether it's really useful. So much so that now the tendency is to use alcohol-based cleansers, which are like soap substitutes, which also do not damage the skin with the very harsh detergent soaps. And of course, it is important that the patient also changes their clothing frequently, doesn't allow sweating to sort of remain on the body for a long time. We have this tendency in India where bathing is usually only in the morning, and then the whole day goes by. For children, they're playing and they're running about, or whatever, workers, they're working, and especially in the rural areas where hygiene leaves much to be desired, maybe because even water is not easily accessible. But we really need to highlight these points about maintaining good hygiene, because that can be a source of infections down the line, whether it can be bacterial or fungal, and therefore it is very important this is one of the, these are one of the ways one can observe good skin hygiene. But also we have to look at the skin from a health point of view. So that would include a lot of other general measures, like, you know, eating healthy foods like fruits and vegetables, and getting your rest, good sleep, and also observing if you have any skin lesions coming up, looking at them in time and going to the doctor, showing it, you know, because most times what happens is that people take over-the-counter medications, which frequently leads them into more problems.
Okay. You mentioned earlier leprosy and vitiligo. Could you elaborate on these diseases and the issues that we encounter because of them?
Yes, you know, that was the first point of the 3 or 4 point sort of highlighting to be done for the Skin Health Day. Leprosy has to be detected and treated early. I had spoken at length on this subject in a previous talk, so I'll limit myself, but it's very important to know that the patient has leprosy. So it has to be diagnosed in time and treated to prevent, first of all, deformities, and secondly, the spread. So leprosy is a very slow growing sort of causative organism that causes it, and leprosy is has a long incubation period, from sometimes from 1 year to 5 and even up to 20 years. Now, it can start with a hypopigmented patch anywhere on the body that is anesthetic, or that is has loss of sensation. And if the patient's immunity is good, it just remains at this stage, or even can be overcome by the body's immunity. But if the body's immunity is poor, then it goes on to progress into a borderline where the lesions become more, they are reddish, they are raised, they increase in number, and of course you have skin, nerve involvement, where you can have loss of sensation of the hands and of the feet, and you can even later on in later stages get paralysis of certain muscles, like you have a wrist drop or a foot drop. And finally one gets to the lepromatous leprosy stage, where the whole entire body is affected, the skin of the body and then the systems also, and it has a lot of morbidity and mortality. And at this stage the patient is frankly very contagious. So that is why it is very important for its early detection and its treatment. Now, coming to the second disease, what we mentioned, this is also one of the points that are being highlighted, because vitiligo has a great sort of social stigma to it. So the association is focusing on creating awareness and the eradication of this social stigma. Vitiligo is a disease in which there is depigmentation. That means the skin becomes white. There's no, the pigment cells are being destroyed by antibodies, which are being formed by the body to parts of its own cells, like the melanocytes, and they get destroyed. And therefore, there is this complete loss of pigment. And it starts with patches here, there, and then it gradually increases until you know, it can affect the whole body. But this disease does not affect the health of the person in any way. So it is just a cosmetically sort of unacceptable disease. And so the IDVL wishes that this awareness is made throughout the country. In fact, they've set a target for 3 months, like, you know, just so as to be able to reach to the general public, especially the illiterates and those who are have these ideas in their mind, because sometimes daughters and girls are not even able to get married because of this social stigma. So there are various treatments available for this disease. No doubt some of them are very costly and not everyone can afford it. So rather than running from pillar to post trying to treat it, of course those who are financially well off can well afford to do so, but those who aren't would have to sort of cope with the disease. And therefore, with a different frame of mind to its approach, the problem could be mitigated to a great extent.
Okay. So I'd like to pick up on two things that you just said.
Yeah.
One is, a different frame of mind with reference to vitiligo. Are there counseling services in that space?
Not apart from what the doctor would be, telling them. I'm sure elsewhere there are these support groups which they have for many other diseases as well. But in India, we are lagging behind in that.
Okay. The other thing that you mentioned earlier on when you were talking about leprosy was, and you mentioned it at 2 points. First, you said containing the spread. And then you talked about the patient being contagious.
Yeah.
And I think there's never been complete clarity around whether or not leprosy is contagious, is an infectious disease. I think many people earlier believed that, and then subsequently we were taught that it is not contagious, it doesn't spread. So what is actually the truth?
Actually,
around that?
it is mildly contagious. So we see from the long incubation period itself, the bacilli are very slow growing. So, but once this stage is crossed and the patient has the infection, it depends on the immunity of the person. So if the immunity is good, that disease is more or less contained, the bacilli are not spreading that much, and the person is not infectious. So
To another person.
Yes. But
Okay.
when the immunity sort of breaks down and then the bacilli are multiplying and they're present all over the, in the systems, then that patient can be highly contagious. And that's how it is spread, even through droplet infections. Yeah.
Okay.
That's why overcrowding and all poor socioeconomic status, they sort of worsen this case scenario.
I see. That's good to know.
Yeah.
What are some of the common skin diseases that one would encounter?
There are many common skin diseases, but I guess for lack of time, we will just take a few. Just to talk about acne, which is so common. I think everyone must have suffered from it at one point of time or another in their life. It's a sort of a sensitivity to the androgens that are secreted, the hormones at puberty, and therefore there's excess sebum secretion on the face, and there is clogging of the pores, and then formation of comedones, and there are some bacteria which are commensals on the skin, and that adds to the inflammation. And it should be sort of looked at and treated early, because if neglected and the patient has a tendency to have a worse disease, then it can leave behind a lot of scarring and damage to the face, and in the long run it would affect the sort of well-being of the person, especially when they're young, they're just growing up, and then they've got this scarred face. It affects their morale, their self-confidence. So it's important, even though it may be part of a physiologic process in that sense, it's important for it to be treated. And then there are various forms of treatment depending on the grade of the acne. So in simple enough early types of disease, you can just keep it under control with washing the face frequently with some maybe antibacterial or salicylic acid or benzoyl peroxide washes, things like that. But later on one would have to go in for more treatment like antibiotics or retinoids or things like that. But basic measures could be taken by the persons themselves when they wash their face frequently, do some exercise, keep a diet which is not very rich in carbohydrates and oils and fats and dairy products. although even the diet is also not considered that much of an issue here in this, but we do advise the patient to do all these things, even to rest well, sleep well. Even stress can worsen acne. There are so many causes. I'm just talking very briefly, like, for this thing. Yeah, that's about acne. And then we go to a very large group of skin lesions which we call eczema. So eczema is a broad term that involves a lot of different types of dermatitis or inflammation of the skin, and it starts with red, itchy, inflamed patches, which the patient keeps on scratching, and then can cause damage, then it can get infected. So it's a whole sort of a disease that can, if treated early, it can sort of just resolve very quickly, but usually the patient neglects. And dermatitis can be of various types, like we have a contact dermatitis. It can be allergic or irritant, or then you can have atopic dermatitis, where a person has basically a hypersensitive skin. Then there is seborrheic dermatitis, where there's excess of sebum secretion, or there is even stasis dermatitis because of varicose veins. There are many forms of dermatitis. But the bottom line is that, they must be looked at early in order to get rid of it completely. We get patients who have had this eczema for a long time, scratching and applying over-the-counter creams which just make the whole thing worse, and then it takes so much longer for it to for the skin to heal and come back to normal. In fact, people don't know, but the skin has got 6 layers. In fact, it has 3 if you talk of the epidermis, the dermis, and the subdermis. Right. But the epidermis itself contains 4 layers. Then the dermis contains 2 layers. And by the time the turnover of these different layers occur, it takes around 6 weeks. So, it's not like a cough and cold. You take treatment for 5 days and it's gone, These things sort of take long time, and that's why skin was always looked at as being very chronic. But if looked at early, it just gets better.
So when you talk about looking at it early, how does one identify that, yes, it is something that necessitates me going to a skin specialist? Because if it's an itch, normally you would say, okay, it's a bite, it was a bug, it's an allergy to something. Yes. But at what stage do you identify that, okay, I need to go to a doctor?
Yes. See, if it passes off in a couple of days, even 3-4 days, it's fine. But if it's bothering you, it is itching, you're scratching, it's spreading, you feel it's getting infected or whatever, then you need to have it shown. And definitely do not go to the chemist and ask for over-the-counter medications, because inevitably this leads to further complications. Yes. Then there are, I would like to talk about other conditions like infections. We talked about eczema, now infections. Infections can be of various types. It can be bacterial, it can be fungal, it can be viral, and even, of course, it can be because of the mycobacteria, either tuberculosis or leprosy. So infections due to bacteria may be, boils and things like that. It can get bigger, it can get into an abscess or cellulitis, and of course they require antibiotics. If they are just mild, only locally on the skin, but if they are severe, then you need internally as well. And then you can have fungal infections. Now these are proving to be a big problem, which I think I'll deal with in the next point, because they are not recognized, and people are using over-the-counter combination creams, and with the result it just goes on spreading. It's very important to identify that this is a fungal infection, and then you have to sort of treat it as such to eradicate it. Then we can have viral infections like warts. Warts are quite frequent, yeah, especially among children. There are the verruca vulgaris, but also you can have the molluscum contagiosum, which by the very word suggests it is contagious, you know, because the virus can get inoculated here and there, and it spreads, yeah. So these are very briefly about the infections, but of course, you would require really a lot of time to talk about the different types and the types of treatment that one would have to give for them. Yeah.
It's interesting that you talk about warts, because I don't think most of us realize that they are an infectious condition. And unless it's on the face, people would normally ignore the growth of a wart on most other body parts.
Sometimes I've seen cases where they've come with warts all over, like, you know, so they've just kept on postponing. But you know what, the thing is that it is quite difficult also to treat them, because you have to, cauterize them and either remove them in toto, or keep on applying some acids regularly. Yeah, so it is quite challenging.
When you talked about fungal infections, and in an earlier point as well, you talked about the prevention of misuse or the abuse of topical steroidal creams.
Yes.
And I think that's one of the mandates of the association as well.
Yes.
What are some of the harmful effects of these creams? What is meant by the abuse of these creams? And how is it planned to create an awareness around this?
Yeah, yes, this has become a big problem, because when the patient develops a fungal infection, they don't know it, they don't recognize. They go to the chemist, and the chemist doesn't know what you have, but he knows that, well, certain creams are prescribed and certain patients come and they give it. Now, in times of emergency, if you're really itching and it's nighttime, you can't meet a doctor, I mean, you could do something like that. But then the next day, do make it a point to go and see a doctor. Because what happens, most of the time, these combination creams have a steroid in them. They have an antifungal and they have an antibacterial. It's like, I would say, a shotgun therapy. You just train your gun on it, and something or the other will help your dermatitis. Well, steroids have the ability to reduce the inflammation, suppress the inflammation. So the patient is very happy, their itching seems to come down and it seems to be clearing, but that is only because of the suppression of the inflammation. But in effect, it depresses the immunity of the skin, and therefore the fungus keeps growing. And it grows and grows, and we see cases in which this disease has spread all over the body. And worse than anything else is now that the fungus has become resistant to all forms of treatment. And India has become infamous for this, and we call it the superbug. The association of the IADVL has come out very strongly about this practice of using these combination creams, especially with the steroid, and in the hands of those who do not know its potential harmful effects.
Okay.
We as dermatologists all use steroid creams, but at the right indication and for the right amount of time, because we know about the side effects that can come up. One is resistance, depressing the immunity of the skin. But another thing is the harmful effects themselves of steroids on the skin, which cause like even atrophy. Because we have seen that in some fairness creams, in addition to the other ingredients, also a steroid cream is added. Now, when we use it as dermatologists, we use it for a limited amount of time because of various reasons. But what happens, the patient thinks that they're getting some good effect, and without following up with the doctor again, they continue using those creams. And then they come with all sorts of, side effects. So it's not that the steroid creams in themselves are a problem. In fact, we use it very much so in dermatology. but it's the misuse and the abuse of such topical steroid creams that cause a great problem. It's for the patient, and now we are having this problem that, you know, we have nothing else left in our armamentarium to give these patients, because if the latest treatments are given, before they used to resolve within 8 days. Now orally I'm talking. In the good old days, just a local treatment was good enough. Today, even the oral treatments are failing, and we have to give it for much longer time. And even now we have seen, after stopping the treatment, when you think the patient is fine, we have seen relapses within a month. And really this is becoming a very serious problem, and the public, that is why the IADVL has taken upon itself this task of spreading this awareness. In fact, they have created a task force against the use and misuse and abuse of topical steroid creams.
Okay.
Yeah.
Okay. Dr. Brenda, I believe quackery is quite rampant in dermatology. How would you describe the term? How can a patient recognize someone who is not qualified?
Yes, that is another problem that the IADVL is addressing now quite seriously, because of the side effects that they have seen, where people who were not trained in dermatology have been doing procedures like whether it is laser or hair removal or peels or all the cosmetic procedures. Today dermatology has gained a name for itself because of these beautifying processes, like women especially and even men are in the search of having sort of a more beautiful skin or complexion or whatever, and they go in for all these procedures. And so it has happened that there are many who have got into this field and who are practicing without the necessary degrees, the qualifications, and even registration with the medical councils. So that is how we would describe persons who are practicing these procedures in dermatology, who are not trained, who do not have legitimate degrees from recognized universities, and who are not even registered on the state medical councils. It is very important for us all as doctors to be registered on the medical councils, the state as well as the the Medical Council of India.
Okay.
So in fact now the IADVL also has started a task force against quackery, because throughout India they have been seeing very bad fallouts of treatments which have been done without proper knowledge of the skin. Now, we study for so many years, not only in medical college to qualify as a doctor, but thereafter for our post-graduation as specialists and consultants. You have to know the basic anatomy, the physiology of the skin, the histology, the pathology, how various drugs affect the skin, and what side effects they produce, what procedures can cause what, how to deal with them, how to prevent, not only prevent, but also how to deal with the side effects and adverse effects. And all this, unless studied, is Greek and Latin to those who have not done so, and therefore they cannot handle it. And I believe that there are a lot of cases where a lot of harm and damage has been done to people.
True.
Yeah,
That's true.
yeah,
I know of cases myself.
Yes, yeah.
And it's good that you said that, because I was
Yeah.
just going to ask, is the association taking any steps towards vigilance in this area?
Yes, so they've created this task force,
Yeah.
and they advise us also to sort of educate the patients also. And it's up to, I think, the patients and themselves to have this sort of responsibility, that when you go to see a doctor, a qualified person, then you really want to, know all about that doctor, their qualifications. Now it's mandatory for us to put our, the medical council number also on our prescription pads. So. Yeah, all this, and we have to have updates. We regularly have to attend continuing medical education programs, what we call the CME, for which we get accreditation on the number of hours we attend. So all this keeps us updated on the latest medical advances. Yeah.
Thank you, Dr. Brenda,
Yes.
for all of the
Thank you.
information that you've just shared, and we hope that our audiences will be more vigilant patients in future themselves.
Yes.
Thank you very much.
I do hope so too. Thank you.